Good afternoon, everyone. My name is Kelly Callow, and I'm the Director of the Public and Community Health for the town of Hudson, and I would like to welcome you to the Hudson Farmers Market. Let me take this off, sorry. As many of you know, today is International Overdose Awareness Day, which falls on August 31st each year. Although it has been in existence for more than 15 years now, more than ever, this commemorative day is recognized globally as a time to raise awareness about overdose and a time to work towards overdose prevention. Unfortunately, with addiction, the tragic reality is that drug and alcohol use can have a deadly ending. From 2018 to today, we have lost 20 members of the Hudson community to a fatal overdose, represented by the purple flags on the lawn. Also, since 2018, 53 Hudson community members experienced a non-fatal overdose, represented by the white flags on the lawn. When it comes to addiction and overdose, there are a lot of statistics that illustrate the degree to which our communities are suffering from an addiction epidemic. It isn't necessarily easy to digest the full spectrum of the problem, but consider this. Whether it be you, your child, your parent, your grandchild, a sibling, a friend, or your spouse. Any person under the age of 50 is more likely to die of a drug overdose than any other cause. Statistically speaking, if you're under 50, you're more than likely to lose your life to a drug overdose than cancer, a car wreck, or any other illness. Overdose is one of the single biggest killers of our country. While overdose is the leading cause of accidental death in the United States and quickly rising among both men and women of all races, there has never been a more important time than to break the silence and the stigma to talk about overdose. While overdose deaths were already increasing in the months preceding the COVID-19 pandemic, the latest numbers suggest an acceleration of overdose deaths during the pandemic. In 2020, there were 299 confirmed fatal overdoses in Middlesex County. 2,035 confirmed fatal overdoses in Massachusetts. The CDC reviewed death certificates to come up with an estimate for the 2020 drug overdoses. The estimate is over 93,000, which translates to an average of more than 250 deaths per day, or roughly 11 every hour. That is an increase of about 71,000 from 2019, marking it the largest annual increase in the last 50 years. The disruption to daily life due to the COVID-19 pandemic has hit those with substance use disorder hard. As we continue to fight to end this pandemic, it's important to not lose sight of different groups being affected in other ways. We need to take care of people suffering from unintended consequences. There's no way around it. Having the need to recognize overdose is unfortunate. However, it's critical to have a day like this in order to encourage recovery from addiction, to educate the public about this epidemic, and to allow families to grieve the loss of loved ones. International Overdose Awareness Day gives us and people around the world a chance to talk openly about the realities of addiction and overdose. In order to bring change, we have to talk about this. We have to get down to the sad facts, we have to break the stigma, and we have to remove the shame. We have to find solutions. Thank you so much for joining the Hudson Health Department and the Hudson Youth Substance Abuse Prevention Coalition in remembering those who we have lost, supporting those who are in pain, raising awareness, and reducing stigma. Now, I would like to introduce Lauren Antonelli, our Regional Youth Substance Use Prevention Coordinator, as she will take on the rest of the program.
Good afternoon. Thank you, Kelly. As Kelly said, I'm Lauren Antonelli, the Regional Youth Substance Abuse Prevention Program Coordinator here in the Hudson Health Department. I'd like to join Kelly in welcoming you all to Hudson Town Hall and to our International Overdose Awareness Day ceremony. In my work, I oversee the Hudson Youth Substance Abuse Prevention Coalition, YSAP, as well as a regional collaborative that includes Ashland, Marlborough, Natick, Northborough, Southborough, and Westborough. Thanks to a generous grant from the Department of Public Health, we recently received funding for the next 8 years to support our youth substance abuse prevention initiatives. While today is about remembering those we have lost to overdose and supporting those who have been impacted, which I'm sure is most of us here today because, as Kelly just highlighted, the disease is truly an epidemic. But we must also talk about prevention, education, and raising awareness as part of the solution. Please visit our table when you get a chance, where you can find my contact information if you would like to join in our efforts and become a member of the Youth Substance Abuse Prevention Collaborative. And without further ado, I would like to welcome and introduce our esteemed officials who have joined us here today. We have Congresswoman Lori Trahan, State Senator Jamie Eldridge, and State Representative Kate Hogan. Thank you all for making it a priority of yours to join us here today in recognition of International Overdose Awareness Day and for all the work you do to support the efforts of the treatment, recovery, and prevention communities. I would first like to welcome Congresswoman Trahan to the podium to make a few remarks. Give a quick bio. You sure? Okay. All right. Thank you.
All you really need to know today is that I'm honored to be here, and I've been to a commemoration for Overdose Awareness Day even before I was elected on August 31st. In fact, I just got my children off the bus and I said, you can stay up late tonight because I'm going to a few events. You know how important this day is. And they looked at me and they fully understood, because they know what this day means for too many families across our country, certainly here in Hudson. So I just want to thank you for inviting me this afternoon. It's such an honor to be here alongside Senator Eldridge and Representative Kate Hogan, Kelly, Lauren, Tracy, and all of you to commemorate International Overdose Awareness Day. Opioid awareness events like this one are taking place in hundreds of communities across our country and dozens of counties and countries across our globe. The disease of addiction is destroying lives. Just in the United States, over the last 20 years, opioids have led to more than 400,000 overdose deaths. Substance use disorder has claimed over 81,000 lives just last year alone, the highest number of overdose deaths ever recorded in a 12-month period, and has shown no indication of declining. It's clear that the COVID-19 pandemic has exacerbated circumstances for those suffering from addiction. I continue to believe that we need not just a whole of government, a whole of society approach to tackling this public health emergency. We know that the opioid addiction crisis cannot truly be measured in just numbers alone. For those who have lost the battle with addiction, they are their treasured lives. Beloved sisters and brothers, moms and dads, daughters and sons, wives and husbands, whose absence we mourn every day. And over the past 2.5 years, I've met too many families who have suffered the loss from an overdose death. Their stories will always strike a chord. They have actually guided my work on this critical issue in Washington. My heart goes out to those suffering from SUD. I've sat with moms and dads who have lost a child to an overdose, the worst thing a parent can imagine. Families in our own communities, like Tracy and Gary Carter, here with us today, and the founder of Team Sharing, my good friend Cheryl Jouer. They deserve compassion and understanding, free from judgment. The fighting spirit of Gary, Tracy, Cheryl, and so many others across the Commonwealth and our country is what has been turning the tide and will ultimately win this battle. Frankly, grassroots efforts to save our children's lives have been waging this war for far too long without adequate support from Washington. Families across this country are suffering, and Washington simply hasn't been adequately listening. The federal government has a responsibility to all Americans, particularly our young people, to do more to defeat the opioid and substance use disorder crises through greater attention to preventative measures and safer, more effective treatment options. I am pleased for the opportunity today to provide an update from Washington about what is finally being done to curb this epidemic. My bill, which I co-authored with many of you, team sharing for sure has informed so much of what we've done. The Medication Access and Training Expansion Act, it's called the MATE Act. It would ensure that prescribers of controlled substances at a minimum have the baseline knowledge to identify, treat, and manage their patients suffering from substance use disorder. Both stigma and a lack of understanding about addiction, including within the corners of our medical community, have prevented far too many Americans from accessing evidence-based care for this chronic, treatable disease. To address these challenges, we must better equip medical professionals across the healthcare continuum to treat SUD. And that starts with standardizing and mainstreaming access to medications for addiction treatment and education on how to integrate that treatment of SUD into medical practice. Though many DEA prescribers have to take some sort of safe prescribing education, the lack of adequate education in the treatment and management of patients with SUD is particularly acute among prescribers of DEA-controlled substances. Across different clinical settings, these healthcare professionals often interact with and have opportunities to provide effective interventions for patients with SUD, opportunities that right now are too often missed. Specifically, the MATE Act will require that controlled medication prescribers have completed at least 8 hours of qualifying education on treating and managing patients with substance use disorders from an accredited medical program. 8 hours. The bill will also authorize federal grant funds to professional associations, universities, and other schools to develop and implement high-quality, comprehensive curricula on identifying and treating SUD to satisfy the training requirement in the bill. Additionally, as we continue to build back better for the American people, Congress now has the opportunity to pass policies and bold levels of funding to assist our communities, all of you, in the fight against SUD. Too often we hear about obstacles that get in the way of someone seeking treatment. The American Rescue Plan provided $1.5 billion for SAMHSA's Substance Abuse Prevention and Treatment Block Grants. The package provided $80 million for a new grant program for community-based and behavioral health organizations across the country, along with $420 million for certified community behavioral health clinics. Further, as we debate the Build Back Better Act this fall, I've urged inclusion of bold provisions that work to end substance use disorder, like reinvestments in public health, and the authorization of $10 million to SAMHSA and other related agencies to fight the opioid epidemic, and $300 million for behavioral health workforce training programs. With Senator Markey, I've also urged the Biden administration to further reduce barriers to safe, effective, medication-assisted treatment that continues to be underutilized beyond the pandemic. So before I wrap up, I just want to mention the continued efforts at the federal level to recognize SUD as a chronic disease that should be treated as such continues. Although we were unable to get the U.S. flags lowered to half-staff today, I'm grateful to the administration for issuing a presidential proclamation to declare this week Opioid Awareness Week. And rest assured, we are going to continue to our quest to lower these flags. I've got great partners working with us on that. These are all just a few of the things that Congress has been working on with this new administration, but to be clear, we have so much work ahead of us. I want you to know that the work is very close to my heart. I'm prepared to stand side by side with all of you to finally beat this epidemic. I have a certificate that I want to give to the town of Hudson, because there's no better way to defeat stigma and really help educate a community than to have events like this and to put a spotlight on all the efforts and all the services that are here to help folks who are struggling from SUD. But now it is my honor to introduce my friend, my colleague, my partner in this fight, State Senator Jamie Eldridge.
So thank you so much, Congresswoman Trahan, and I just really want to thank you for being here, for your vision, for your compassion, and for laying out the vision that the federal government is looking to provide and has provided to families who have suffered a loss from opioid use. And I just want to say, first of all, looking out whether to Tracy Carter or to everyone wearing your purple shirts or a family member or friend, is that I'm so sorry for your loss. And these events are so important to remember the loss of your loved ones, and to remind elected officials, whether at the federal level, the state level, the local level, that we need to do more, not only to end the stigma, but also to take action to better support people across Massachusetts and, of course, across the country. I want to, in addition to Congresswoman Trahan, I just want to give a special thank you to Kelly and to Lauren for organizing today's event in Hudson. And I hope that you realize that you really have very special public health and municipal public servants here in Hudson, in part who are doing a lot of outreach to address substance abuse. Hudson is part of a partnership with multiple towns across Massachusetts that's looking to do that education, that looking to do that outreach, and many existences from state funding that I know Representative Hogan and I have championed over the past few years. And talking about the End of the Stigma campaign, I just want to give a special thank you to Representative Hogan, because she is one of the leaders of that effort in the legislature for the End the Stigma campaign, and continue to do outreach, both in her capacity as the former House Chair of the Public Health Committee and now in her position as the Speaker Pro Temp of the House of Representatives. So she has shown tremendous leadership as well. And, you know, Congresswoman Trahan mentioned Shosh, where, and I think many of you know that very sadly she just lost her second son to substance abuse this summer, and there will be a service later today similar to this in Marlborough. But I'm thinking of her. She has done tremendous outreach with Team Sharing, raising money for education and outreach. And the reality is government needs to do more. Government needs to step up and provide more support. I think there was such a focus on combating COVID and dealing with the pandemic over the past year and a half, that I think in some respects there hasn't been as much of a focus on substance abuse and Opioid Awareness Week. And so it's important for us to think about that today, but to take action going forward. For a number of sessions, the legislature was passing comprehensive legislation to combat substance abuse and to address opioid addiction. And I think we need to get back to that now that things are looking better on the pandemic front. We need to not only invest in funding, but I think change a lot of the laws to provide better support to people before they fall into addiction. And we're here the day after the final withdrawal of U.S. forces from Afghanistan. And I say that because probably one of the communities that has been most impacted by opioid addiction is the town of Shirley, which I also represent. Shirley is a military town. A lot of the young people from there, like communities across my district, served in the U.S. military. And I can remember sitting down with multiple families of men and women who served in the U.S. military, had an injury in Iraq, had an injury in Afghanistan, and came back addicted to painkillers. And it was just that let them fall into addiction, and in some circumstances never come back. In many respects, for a lot of them, it was about barriers, whether barriers with the Veterans Administration, barriers with their health insurance companies, and also just a lack of hope of coming back and not getting more support. So I think that's something we need to focus more on. Hopefully you are aware that I am a big champion of making healthcare a right, of eliminating these barriers that health insurance companies, that often healthcare providers put up to families of getting a bed when a son or daughter, a loved one is suffering from addiction, making sure that health insurance companies provide the full treatment and not just 30 days of treatment when someone has fallen into addiction. So making healthcare right. And part of that, and this goes back to the work of Kelly and Lauren, is those investments in public health. I think one of the things that the pandemic really made all the more true all the more raw and real is the lack of investment we have in our public health departments, our public health professionals. And yet every aspect, whether education, outreach, assisting families, assisting people that are struggling, public health are the front line of defense around substance abuse and every other epidemic. And so we need to provide more investments. That's something that I think has been made more of a priority as a result of the pandemic, but it should be just as much a priority because of what families continue to struggle with addiction to opioids and other substances. So thank you so much for being here. Again, thank you for all the organizers. Again, thinking about those who have lost their loved ones today. I think that we have in many respects ended the stigma. So now it's about government policies, it's about investment, it's about restoring hope to people that are sometimes struggling through other challenges to truly end what is just a real tragedy across the state and across the country. So thank you so much for having me. And as I mentioned before, Representative Hogan has been a tremendous leader on this front, and it's my pleasure and my honor to introduce your state representative, Representative Kate Hogan. Thank you.
Good afternoon, everyone. I will be brief, but I did want to come here today and very humbly say it is so important, so very important that we gather together to remember the lives that have been touched in our community by overdose. It's so important that we gather together to recognize and remember the lives that have been touched. Hudson is just one community, and all of you are individual families, but among many in Massachusetts that are battling opioid and the opioid crisis. And despite the advances that have been made in treatment and in prevention, the opioid crisis in Massachusetts is still just that. It is a crisis. Unfortunately, the COVID-19 pandemic has only exacerbated the opioid overdose crisis, and we have seen everyone here speaking so well about the numbers and the issues and the outcomes, particularly among people of color and individuals living in underserved areas. Our public health workers and resources have been taxed mightily over the past year and a half, and they continue to rise to the occasion. And I so appreciate all the work of Kelly Kalo and her office, her team. They continue to do great work in a relenting public health crisis upon public health crisis. We also know that access to mental health services, housing, jobs, education, those wraparound services that if we can get someone through are there to bring them back into society, that they are there to reduce opioid overdoses, and that it's reflected in our investments. Massachusetts stands to receive more than $500 million over the next 18 years from Johnson & Johnson and 3 drug distributors, $90 million from OxyContin manufacturers, but none of those bring back the lives that were lost. None of them bring back the lives that were lost. I just want to say, please, keep the faith, keep showing up. And I have a citation here from the Commonwealth of Massachusetts to the Hudson Health Department and the Hudson Youth Substance Abuse Prevention Coalition in recognition of International Overdose Awareness Day by remembering those we have lost, supporting those in pain, raising awareness, and reducing the stigma. Keep the faith, and God bless you all. Thank you very much.
Thank you, Rep. Hogan, and thank you to all of the elected officials who joined us here today. I would now like to introduce a very special woman from our community, Mrs. Tracy Carter, who has so graciously agreed to join us today to share her personal experience with overdose. I know it is not easy, but you sharing your story is truly a gift to all of us and will undoubtedly leave a mark in the hearts and minds of all of us here today. Please join me in welcoming Tracy.
Thank you, Lauren. Good afternoon. My name is Tracy, and that's my husband, Gary. And our family lost our son, Bryant, to a fatal overdose on February 23rd of 2018. Bryant courageously fought the disease of substance use disorder for over 8 years, only to lose his battle. You're the only one with hearing. Thank you. Better?
Thank you.
Thank you. Bryant courageously fought the disease of substance use disorder for over 8 years, only to lose his battle in my home, in his own room, at the age of 25. When Lauren invited me to speak tonight, she didn't know me very well. She didn't know public speaking scares the bejesus out of me. She didn't know I'd rather poke my eyes out. She didn't know I lost both my parents to the throes of alcohol before I turned 20. But what she did know is that I am passionate about the fight against substance use disorder. I am determined to be a voice for our children. I am on Hudson's Coalition for Youth Substance Abuse Prevention, and I am on the board of Teen Sharing. I do not hesitate to talk about my son, and I reach out to struggling families so that they have a safe place to talk about their children. Lauren asked me at just the right time, because I have just heard a story from a grieving parent that needs to be told. It needs to be shouted from the rooftops, and I am humbled to be able to share it with you all. But first, let me give you some background for context. Bryant is one of many children that you'll see on the banners on the grass. These banners were created by Teen Sharing, which is an organization of parents that have lost children to substance use disorder. There are several reasons the banners are important, and I am grateful to the town of Hudson, and Kelly and Lauren, for displaying them here today. One is to make sure that our children are never forgotten. They mattered, and we say their names often. Another reason is the one I want to talk about tonight, and that is that these are the faces of the disease of addiction. It's not what you see in the movies. Substance use disorder takes valedictorians, all-star athletes, lawyers, doctors, those of privilege, and those of strife. It does not discriminate. Addiction doesn't just happen from partying too much. Some people start out with a prescription for an injury. Some start out because they're trying to self-medicate for a trauma. Many children got started because they had their wisdom teeth out and they were given Percocets for a pain that Tylenol could handle. And yes, sometimes they take a pill or have a drink at a party because it's the cool thing to do. These are good kids and adults from all kinds of families, and they are somebody's child. There is a theme here. Have you ever thought about what the parents of these children look like? They are valedictorians, all-star athletes, lawyers, doctors, those of privilege, and those of strife. They look like me, and they look like you. They are me, and they are your friends. You might not know it yet, but you know someone affected by substance use disorder. It could be a family member, a neighbor, a coworker, or a friend. With this disease taking over 800,000 lives, and with over millions of people suffering, you know someone. The reason you don't know exactly who it is because there is a strong stigma surrounding this disease. It comes with shame and guilt, and often the families suffer alone in silence. And this story shows why stigma thrives in silence. Okay, now for the story I promised you. This mom, that I will call Joan, was on a Zoom call at work. The call had about 25 people on it. And if you've been on a Zoom call, then you know sometimes you can just listen in. Your face isn't on screen and your microphone is on mute. This was the case for Joan. She was required to be at the call, but she didn't have to participate in the meeting. At one point, her boss asked for an update on a particular client. The salesman stated that the client was in rehab, so he hadn't heard back from him. Now, it's important to note that the client was in rehab for a hip replacement. It shouldn't matter, but that's the point of the story. It does matter. One of the team members called out, "Oh boy, he's not at the Washburn house, is he?" And many of the people on the call laughed. No, he's at UMass Memorial, don't you worry. People laughed again. Joan didn't understand the laughter, so she Googled Washburn House. It turns out it is an inpatient facility for substance use disorder. I can't tell you what happened next because at that moment, Joan disconnected the call. She disconnected the call in shame. And that turned to anger, which turned in a call to me. These co-workers didn't know she lost her child to addiction. She had changed jobs and decided not to share that part of her story. Joan now knows what she always knew. There's a stigma with addiction that encourages silence and shame. If a person is getting treatment for cancer, we rally with meals and rides to appointments and family support. If a person is in rehab for surgery, we rally with meals and rides to appointments and family support. And if a person is in rehab for substance use disorder, the person and the family are often left alone or worse, avoided altogether. Substance use disorder gets a bad rap because treatment rarely works the first time, or the second, or the third. This reality shouldn't matter because cancer can come back. Sometimes knee replacements need to be redone, and no one ever considers that a failure. If addiction treatment doesn't work, we blame the person, not the illness. I know what you're thinking. You would never do that. You would always help a person going through this pain. You would never judge a family just because someone is suffering from this disease. You would never. Well, I'm here to tell you it happens. It happens all the time. So my message to you tonight is that we need to be the change. If you know a family's struggling, don't judge. See if they need a break from giving rides to treatment. Bring them a meal. Let them know they are not alone. If you hear a joke about substance use disorder, speak up. If you can't speak up, walk away. If you can't walk away, don't laugh. This disease is taking an entire generation, and it's coming for your loved ones too. My name is Tracy. That's my husband, Gary. We lost our son to the disease of substance use disorder. Thank you for coming out today to remember all the lives lost. May God bless you and your families.
Thank you, Tracy. Like I said, I knew that would definitely be an inspirational and really heartfelt story that hopefully will last with all of us for a very long time to come. So that just about concludes our speaking program. Again, thank you all for coming. Thank you, Tracy. Thank you, Congresswoman Trahan, Senator Eldridge, and Representative Hogan. Please, like I mentioned before, visit our resource table. We have a lot of great information on how to spot an overdose, how to assist in an overdose. Our partners from JRI's program RISE is here today with free Narcan that you can take home with you. We'll also be doing a couple trainings this Thursday, which we have information on for a virtual Narcan training if you'd like to take the full training. And you can receive the Narcan in a variety of ways after that. We also have our partners at the police station here who are collecting unused, expired medications to get those off of the streets and out of the medicine and bring them today. There is a box at the police station that you can access 24/7 to dispose safely of them. And yeah, like I said too, you could join our Youth Substance Abuse Coalition. My information is there. We would love to have anyone take the information, tell a family member, tell a friend. The more the merrier, because this truly is a community effort to help combat substance use disorder. And finally, we're going to turn over our speaking program to a musical performance from a friend, Mr. Paul Alves, otherwise known as Overhaul Paul, who has joined us today. He himself is in recovery and works in the field of recovery now, using his own past experiences to help others. And so we're super excited and grateful for him agreeing to come and share some of his music, which is of course inspired by his experiences. And he'll be here through to the end of the farmers market, and of course take advantage of all the great vendors here at the farmers market. So, thank you all. Thank you.
Stranger in this town, can you help me out? Tell me anything, tell me. Stranger in this town, can you help me? Tell me anything, you can tell me. Stranger in this town, can you help me? Tell me anything, tell me. Stranger in this town, can you help me? Tell me anything, you can tell me. I see the sign there points one way. The light we used to pass by walk away running. You won't see me follow you back home. The empty sidewalks are mine. I'm not gonna sing. So not so big. From deep inside the pain that I choose to hide, sidewalk side, gone under
you could find us at choicerecoverycoaching.org. Recovery is real. There is another side to addiction. There is another side to substance use disorder. And there are 23 million Americans in recovery today. Join us. Thank you. This baggage handcuffed to my wrist, I drag it everywhere I go. Sometimes I fight it with my fist. If I only knew which way was home, that's where I'd go. If I knew which way was before the karma come you lose. I drink my whiskey and my water. Sometimes I get the blues, and you know I shouldn't order. That's where I'd go. Which way was home? Down ghost trails, no chance for love, no sign of life. Just wild dogs out here at night. Before the karma set me free, sick of my own company. Most times I miss the boat. Most times I miss my home. That's where I'd go if I knew which way was home. Down those trails, no chance for love, no sign of life. Just wild dogs out here in the nights. Going down those trails, no chance for love, no sunlight. Just wild dogs in the night. In the night. In the night. Hear them howl. This baggage handcuffed to my wrist, I drag it everywhere I go. Sometimes I fight it with my fist. I only knew which way was home. That's where I'd go if I knew which way was home. Pink sleeves, flipping those 50-year-old leaves, shredded all around, all around with those thoughts. Too many to be bought, too many to be fought, too many to be caught, to be caught. Pink sleeves, flipping those 50-year-old leaves, shredded all around, all around with those thoughts. reality. Come and talk to me, so you can say what's going on, 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 Reach your toes, fight off these worn out souls who feel it, do not think of taking away yourself, betraying no one else, talking a walls within, talking a walls within you, talking a wall within. Wanna clip my wings, but I'm flying into the sun. Just do what I need to do, I'm not hurting anyone. It's good blood, I can't help it, it's my blood. I am naked, it's my blood, it's not my fault, just is what it is. Everybody wants to be happy, who am I to deny it? Everybody wants to be happy. It's not the cause and it's not the cure. Think I'm gonna puke and I'm lying on the floor. You better be careful or you won't feel anything anymore. It's not the cause and it's not the cure. Everybody wants to be happy. Who am I to deny it? Everybody wants to be happy. Go ahead and try it. Everybody wants to be happy. laundry in the dryer and took a walk around Hudson, Mass. Check out all the funky spaces. Some vitamin D on our faces. Wonder if the black rose are still around, and if they've got a brand new sound. 'Cause they better not take it from us, 'cause if they do, we'll make a new one up. And if you never go, no one will ever know. And if you never go, no one will ever know me at all. See you on those streets, shaking, shaking along. Seeing you, see you on those streets, shaking, shaking along. Yeah, with your homemade skirt and your button down shirt, and a bubble high in the air. Running into you. So make me do. So make me do. Your shoe is yo, so new. Head up all high in the air. We all don't even care. We just painted it black. We just painted it black. We just painted it black. What a shame. Painted it black. Painted it black. Painted it black. We just painted it black. Not a thought. So we were caught up in the colors. Red, green, violet, blue, black, brown, gray, oh yeah. Summer nights, beautiful times, warm summer nights, warm summer nights, beautiful times, warm summer nights. God exists at recess. 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 Exists until I'm rich. The end of your rainbow. The end of your world. You race. The end of your rainbow. one were down by the pond, looking for something to plant the lawn. Out by the stream they were churning the soil. I'm sitting here hoping this water will boil. As I look out that window, down by the road, they're bringing me presents and saying hello, saying words, between the lines of each words. Between the lines of talking in rhymes, saying words, words, between the lines of ages, words, between the lines of crazy. That's how it goes. Millions of people living as fools. Maybe it's not too late to learn how to love and forget how to hate. Mental wounds not healing, life's a bit too shame. Going off the rails on a crazy train. Going off the rails on a crazy train. dropouts who bend their own rules. One person conditioned to rule and control. The media sells it, and you live the role. Mental still screaming, what's to blame? Going off the rails on a crazy tree. Going off the rails on a crazy tree. Let's go! Years of a Cold War, that's what we've become. I inherited troubles, I'm mentally numb. Crazy. What do we feel? I'm living with something we don't want to share. Mental's not healing. What's to be? Going off the rails on a crazy train. Going off the rails on a crazy train. Going off the rails on a crazy train. Thank you. Muito obrigado. Domo arigato. Gracias.